Hi everyone, willkommen, bienvenidos a todos, bienvenue à tous. I am Marie and welcome to our special edition. Today we're talking about the public health systems. We'll explore all of that, why they matter to us, because really public health systems are really the cornerstone of the health of a population, and they really matter because they can contribute to national development. If a population is very healthy, then you know that country will develop very fast, and systems are key to providing health to all the population, and that's why we're looking at health systems today. My mission, on earth is very simple: to serve God and to serve humanity. And through the platform, I call my platform GREAT. GREAT. G for gender equality, R for reality into action, E for education and empowerment, A for action on climate, and T for training for the future, because we think about the future on this program. So pause a moment and think. Click down there and give us a thumbs up so that we can encourage the wonderful team. There's so many people that work behind the scenes, you can't see them. It's a wonderful team of volunteers here on IFL-SC Global Academy. Okay, so let's dive right into the topic. I want to ask you a question now. When was the last time you went to a hospital? Or you just walked to a pharmacy and bought, I don't know, paracetamol or Panadol or whatever in a pharmacy? Well, guess what? That simple act of going to the pharmacy to get something to cure your headache means that you interacted with the health system. That simple act. But here is a kicker. The health system is way more than just people putting on white coats. I mean, the doctors putting on white coat and in fancy hospitals, very big hospitals. That's not the health system. It's about everything that helps you to stay alive, that helps you to stay healthy, and that helps you not to be broke when you're sick or you're not feeling well. So today we are going to dive into all of that, into that world. It's a complex world, but we'll do it in a fun way so that you understand gradually and you get to know what that big word, health system, it's all about. And by the time you do that, I have a surprise for you at the end of the program. So stick with us, don't go anywhere. Now, imagine that you live here in Africa. I live in Africa. Imagine that you live in Africa, or you live in the tropics, in a tropical region where we have malaria as an endemic disease. And then you wake up one morning, you have malaria. Maybe you need drugs, maybe you need to get the test in the hospital, or maybe you really need the hospital bed where you can be admitted. Now, what happens? Now picture two scenarios. Maybe the first one is that you will pay a token, what you call a premium, and then you walk into the clinic and then you get treated. Another scenario is that maybe you pay out of your pocket. You get there and then they charge you and then you pay out of your pocket. What if you don't have the money? You have to pay out of pocket and you don't have the money. Well, sadly, that is a reality of a lot of persons who live in this part of the world, in the tropics, in sub-Saharan Africa, and most part of Africa anyway. That is their daily headache. A lot of people have to go to the hospital and pay out of their pocket for them to have good health. But the difference is that with a very good health system, you don't need to go and pay out of your pocket. No. When the health system is very good, everything is paid, or you just really pay a very tiny token. Remember, the WHO, which is the World Health Organization, said this some time ago, that a health system includes all the people, all the institutions, all the funds, and whose main aim is to just make the population healthy. Do you understand that? Includes the people, includes the funds, includes all the institutions, and their main aim is to make us healthy. That's what WHO, that's how it defines health system. So let's take it this way. For many of you who love football, because I do, I'm a football fan. I sometimes go jogging and I love football. I play football sometimes. Now, look at it like a football team. Imagine that the health system is just like a football team. If you have a football team, I mean, it's not just a striker who is important. Every member of that team is important. So it's the same thing. You don't only need a striker. who is a doctor. In this our case, in the health system, let's say the striker is a doctor. And then you also need the midfielders, who are probably the nurses. Of course, you need the defenders, who may be the community health workers. And then, of course, you need a goalkeeper, who may be those who are into public health policies. Okay? And then overall, you have a coach for the team. And in this case, the coach could be the government. So, it's simplified that way. Now, in the health system, you have different kinds of care. The health system is there to provide health care. And so there are different levels of that health care. The health system starts from the primary health care level. That's the first stop for most people. It includes local clinics and local hospitals just around the corner. You can actually walk there. For those who are in the rural areas, that's the primary stop for anybody that's not feeling fine. And then we have the secondary care, which is a level 2. They are a little bigger hospitals, usually referral hospitals. Examples is part of the world are what you call FMCs, or the Federal Medical Centers. Those ones are level 2. They are secondary care institutions. Then you have the tertiary care institutions. Those ones now are at the super level. Usually they offer specialized care like brain surgery, heart surgery, kidney transplants, and all those kind of complicated and very specialized care in health. And a lot of them are linked to universities where research can take place. They're called teaching hospitals. In Nigeria, we have UCH Ibadan, for instance, or if you go to the National Hospital in Abuja, it's a teaching hospital. Those ones are very, 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 very specialized because they carry out a lot of research in conjunction. They are affiliated to some universities. Don't forget, our situation here, this part of the world, in Africa, in sub-Saharan Africa, in West Africa, is very peculiar because 80% of healthcare in Africa is actually provided by lay people. Who are lay people? People without no formal health training. So 80% of all healthcare in Africa is provided by lay people. Yep, it could be your mother who's giving you some herbal treatment. Maybe you're not feeling fine and she does some herbal concoction mixture, what we fondly call here agbo. Or it could be a friend that's just advising you on, okay, go and get this cough syrup, or do this one, or I got this one and I got better, you also try this. It could even be a sister or a neighbor that comes to take care of you when you're feeling fine. So that's the situation with Africa, over 80%. So you see how important this topic is. It's very important that this kind of people too are part of the healthcare system. Even though they are not formal, they are informal. Lay people, they contribute 80%. So I think the government should look into it. If a section of the population is providing 80% of the healthcare, wow, which means that some of them have to be trained, some of them have to be given the necessary funding, the necessary empowerment and enablement, so that mothers, for instance, can provide that basic care in their home. Now let me take you on a quick time travel. How the health systems evolved the way that we have them today. Well, long before hospitals came into play, our forefathers survived with herbs, with chants, with community wisdom. Those things were helping them to stay alive. And traditional healers, birth attendants were in play. And even today, a lot of women give birth through traditional birth attendants. They play a very big role in our society today, especially in the rural areas. That's why government is being called upon to pay attention to that sector, to train them. Since a lot of people still patronize them, probably because of they don't have money to go to the big hospitals, the referral hospitals. They go to these traditional birth attendants who cost very little. And so the government should see that a huge chunk of the population is patronizing these people. So shouldn't they be supported some way so that they too can be part of the health system and provide very, very qualitative care for our people? Now, after that period, the Industrial Revolution came. It started in Europe. Workers were dropping dead from diseases. And so the companies there in Europe started clinics for their workers. And then later on, government now realized that if people are too sick, the economy suffers, because if people are too sick, they don't produce anything, and then the GDP suffers. So the government paid attention to that. And then some years in 1883, that was in Germany. In fact, Germany was the first country to invent the social health insurance, as many countries have adopted it today. It started in Germany in 1883. And then the UK in 1943 also took its own part. It gave birth to the National Health Service, and they still have it today. Free healthcare for everyone. And now what happened? Some hospitals in this part of the country, or the continent, in Africa, well, a few hospitals were established by the colonial masters in some villages, in some cities actually. But sadly, those hospitals were only meant to take care of the colonial masters. They were not meant for the rest of the population. And so you had that disparity, that bias, where you have the hospitals in the cities and then the villages have nothing, because they brought the hospitals to take care of themselves, the colonial masters. So that bias was there at the time. But today, well, there's a global cry that health is a public good. The truth is that health isn't just for a few persons. Health should be a global thing. It's a public good. It's for everybody, and everybody should be treated equally. You should have equal access to health care. And so here's the truth. Health isn't just a personal thing. It's a public good. Because when a child gets immunized against polio, the whole community actually benefits, okay? The whole community is protected. Because you remember during the Ebola period in 2014, Nigeria had a very quick response and so many millions of people were saved. Whereas on the contrary, in Liberia, Sierra Leone, they had a weaker health system there, and then the outbreak now spread across so many people, and have thousands of people who lost their lives. So you see that health is for public good. It concerns everyone. Don't say, oh, it's just for those people who are affected. I am not part of it. No, it could actually come to you. It can affect the whole society. So when the government decide to invest in health, it is not charity. No. It is survival for everyone, both those in power and those out of power. That's why the government is always called upon to invest more, because it is for the entire society. And we still have a lot of challenge here in Africa. There is a big challenge in Africa, because here are some very shocking statistics that a lot of people didn't know, that I'm going to bring them to you now. Africa has 11% of the world's population, right? That is known. But Africa carries 25% of the world's disease burden. Do you know that? 25% of the world's disease burden. But we only have 3% of the global health workforce. That's really small. So you see that you find a situation where in hospitals, long queues, a lot of time doctors are on strike, or even when they are there, no bed space, and that is on and on and on. And some governments even compounding the issue, because a lot of governments in Africa spend less than 5% of their GDP on health. For instance, Nigeria, with its massive population, spends only 5% of its global domestic product on health, far below the 15% which was prescribed by the Abuja Declaration target. Abuja Declaration said that government should invest at least 15% of their GDP on health. But today, that's not the case. So, what should be done? Why should you even care? Well, health is about you, it's about me, it's about our future. Whether you will survive now, or if you survive an accident, or it could be your mother that survives childbirth, or a younger sibling that gets vaccinated, or you go broke because you're paying so many bills in the hospital, it concerns everyone. And the truth is that our generation currently has to fix it. We shouldn't wait for another generation to fix the problem we have in healthcare. It's our generation that has to fix it, so that the next generation can come and have things easy. So next time someone tells you, you hear the word health system or healthcare system, oh, don't panic. Don't just think that it just has to do with the hospital or people with white coats or the nurses. No, think about an entire network that keeps the society alive. The entire network, from the lay people and even from the specialized ones and even from those who are trained. It's an entire network. So here's your challenge if you're watching right now. My challenge for you is that as a young African, as a young person, ask yourself, what role can I play in building a healthy society around me? you can also play your own role. Okay, that's it. So what role can you play? Comment, go down there and drop a comment. How can we improve on our health system in Africa? How can we make things better for our youth, for our women? Because have you heard about the missing women syndrome? It's very, very rampant, where a lot of societies, women are dying, if not for childbirth, malnutrition, all kinds of things. The missing woman syndrome is very rampant in Africa. So now let's take things in our hands and play your own part in making the society a healthy place. Okay, before we go, I promised you a surprise at the end of this program. Here it comes. Let's look at 5 key words in English, in Spanish, and in Latin, in French as well. Okay, 5. I just selected 5 so that you can master those ones. I told you that on this program, if you follow us and watch former videos and upcoming ones, you will be able to speak many languages. So let's look at the word health system. Health system. How do you say health system in French? Let's start with French. In French, you say système de santé. Système de santé. Okay. How do you say that in Spanish? In Spanish, you say sistema de salud. Remember, salud means what? Health. Santé, salud. Sistema de salud. In Latin, how do you say that? Okay. In Latin, you say Sistema de sanitatis. Sistema de sanitatis. That is Latin. Okay, let's look at another important word, hospital. Hospital. How do you say hospital in French? In French, you say hôpital. Hôpital. Remember, when it's written, you can see the hôpital has an H, but it is a silent H. It's not pronounced. So you pretend as though the H were not there. So it's hôpital. But in Spanish, you say hospital. And then in Latin, it's quite interesting. You say nosocomium. Nosocomium. That's hospital. Wow. Okay. How do you say public health in French? In French, public health, say santé publique. Santé publique. In Spanish, of course, salud pública. Salud pública. In Latin, what would you say? Sanitatis publica. Sanitatis publica. Wow. Then the next one is doctor. How do you say doctor? Doctor in French, en français, you say médecin. However, it's written médecin. You see, it has 2 accents on the E there. Médecin. But it is pronounced médecin. Un médecin, we say one doctor. Un médecin. 2 doctors. Deux médecins. So le médecin, the doctor. Okay, in Spanish you say médico. Very easy. In Spanish you say médico, or you say doctora. Both go for Spanish. Médico or doctora. Latin, what do you say? Medicus. 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 Doctor. All right, the final one we're going to look at is nurse. Wow, how do you say nurse? In French, en français, nurse is infirmier. Infirmier. If you are a male, of course, because the French always has that gender thing where you have male and female. So, infirmier for male, infirmière. Infirmière for female. In Spanish, what do you say? Enfermero. Enfermero. Okay, that's Spanish also has the male and female, the gender, male and female gender. Enfermero for the male and enfermera for the female. And in Latin, how do you say nurse? That's the last one. Say nutrix. Nutrix. Okay, well, that's our program for today. I'd like to catch you on our next episode. Please do subscribe and make sure you join us on our next episode. Until then, stay healthy and bye for now.